Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot and we're going to be covering nursing exit practice. Now, this is going to be helpful for you if you're taking HESI. It's going to be helpful for you if you're taking ATI. It's going to be helpful for you if you're taking your nursing program's own exit exam. These are common concepts that are found on nursing exit exams. Period. Important things that you need to know that you really should have learned through the program and you're seeing it again. Okay, so this should not be anything new to you. Now, before we get started, as always, I'm going to ask you to please support me and support this channel. How can you do that? I'm so happy you asked. Like this video, go ahead and give me a thumbs up. You're going to love the video, so give me a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There, you will find so many resources available to you. You can get any of my audio lessons. You can get my new book. Oh, I got the green screen on. I don't think you'll be. Oh, geez, you can't see it. You see a little bit. Okay. So this is my book, Nexus Nursing's NCLEX RN NGN cheat sheets. The one for PNVN is coming out soon. It should be out in about 5 weeks. I've been getting your emails. I've been getting your messages. I see them, guys. It's going to be out shortly. It's going to be out in a few weeks. But the one for RN is out right now. You can get your copy on my website, nexusnursinginstitute.com. Now, we had a waiting list because I sold out about 3 times, but I'm back in stock, no waiting list. So when you go on my website to purchase your book, you will get your book immediately. Again, the website is nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms, TikTok, Instagram, Facebook, YouTube. My handle is the same everywhere, Nexus Nursing. And without any further ado, guys, let's get started. Nursing exit exam practice. There's about 10 or 11 slides, guys. First question. Your patient has a shotgun wound to the right upper extremity. What's your priority after dressing the wound and giving antibiotics as ordered? Here are your options. Ask about medication allergies. Check the patient's vaccination records. Apply a splint to the right arm or administer medication for pain. So again, you have a patient that comes in and they have a gunshot wound to the right upper extremity. What is going to be your priority action after you've cleaned the wound, you've dressed it, and you gave your patient antibiotics? What are you going to do next? Here are your options. Ask about medication allergies, check the patient's vaccination records, apply a splint to the right arm, or administer medication for pain. Okay, before I go over this answer, guys, before we started this Kahoot, I told you to wait after the Kahoot to go to my website to buy my book. Don't do it now. I just got a violation from TikTok. They don't like that. Please, please, guys, I promise my book is going to be there after the Kahoot. Wait, after the Kahoot and I log off, then you can go get my book. Because right now, every time you guys leave and go to my website, TikTok hates that you guys are leaving their platform and going somewhere else, and they just gave me a violation. Help a sister out. Wait, guys, just wait. After the Kahoot, you guys can go over to my website. Don't do it now, okay? Thank you. All right. Oh, so the correct answer, guys, is check the patient's vaccination records. Now, here's what killed me. Thank you, Peachy. Peachy said, don't be hard-headed, guys. Here's what kills me. Only 7 of you guys chose the right answer? All right. Let's walk through this question. Again, you're the nurse. You got a patient that just came in with a gunshot wound, right? You dressed the wound, you gave them antibiotics. Let's see what you guys chose as a wrong answer, and then we're going to go to the right answer. So 35 of you guys said, ask about medication allergies. You got to be kidding me. In the question, it says, after giving antibiotics. So you mean to tell me you're going to ask the patient if they're allergic to the medicine after you gave it already? Does that make sense to you? Because it doesn't make sense to me. I would think that I would want to ask the patient about their allergies before I give the medication, because if they're allergic to, imagine you're about to give a penicillin, you're about to give penicillin to a patient that has a severe cephalosporin uh, uh, um, allergy or vice versa. Are you going to give that drug? Absolutely not. You're going to withhold the drug and call the healthcare provider. But the only way you were able to do that was by asking them about their allergies. So you're not going to ask the patient about the allergies after you gave the drug. So it can't be that. Next, 32 of you said that you would apply a splint to the right arm. This patient has a gunshot wound to the right upper extremity. First of all, you're not going to be putting a splint on that arm. You're going to put what? A sling. You're going to put a sling. Why? You want to mobilize that upper extremity. You want to prevent dependent edema. So that can't be the right answer. And 60, oh my gosh, 61 of you guys said administer medication for pain. Let's go back to the question. Your patient has a gunshot wound. I've never gotten a gunshot wound, but I would think gunshot wounds are very painful, right? I would think. So they're experiencing something that's very painful to them. And the question is, what's your priority after dressing the wound and giving antibiotic? Doesn't it make sense that if they have a gunshot wound, which is already painful, and you have to go dig into that wound because you got to clean that wound, you got to dress that wound, wouldn't you give them a pain medication? Wouldn't you give them an analgesic before? Of course you would. You're not a torturer. You're going to give them a pain medication before you dress that wound. So that couldn't be the answer. The correct answer is the one that only 7 of you guys chose. Check the patient's vaccination records. Now, you guys on the live, tell me why we're checking the vaccination record. I'm looking for something specific. Does anyone know why we're checking the vaccination record? Thank you. UN says tetanus. Tetanus. Because if the patient has a gunshot wound, that is something that permeated that patient's body that has some type of metal, right? Yeah, we want to make sure when's the last time they had a tetanus shot. Now, here's an important theme that goes for this question and questions all across the board. You're going to address physiological integrity first. Anything that will change that patient's physiological integrity, such as infection, such as them bleeding out, hemorrhage, hemodynamic status, vital signs, fluid electrolytes. You're going to address that first before anything else. Okay? All right. Let's move on. And this is, let me tell you, this is how these questions get you because you think they're easy. They look easy, but most of the time they're really not. You really have to think about what you're choosing as your answer and why. So these rationales that I'm giving you guys, please, if you're in the nursing program right now, you haven't taken an exit, write this down. This is going to be on YouTube in about an hour. I'm going to post it on my YouTube channel. Go back and watch it if you don't have time to take notes right now. Don't worry about the correct answer because an answer for one test will be wrong for another test. I don't care about the answer. Write the rationale. The rationale, the reason I'm telling you a certain answer is the correct answer, that's what you need to know so that you can apply it to your next question. All right, your patient's admitted to rule out endometrial cancer. Which clinical manifestation is associated with this disorder? Here are your options: frothy vaginal discharge, thick white vaginal discharge, purulent vaginal discharge, or watery vaginal discharge. What do you guys think? Again, your patient's admitted to rule out endometrial cancer. Which clinical manifestation is associated with this disorder? Whenever you see or hear that phrase rule out, that means that's what we think they have. So we're going to rule out all the other possibilities to see if this is what they really have, right? So if we want to rule out endometrial cancer, this is what we suspect the patient has. We haven't confirmed it, but this is what we suspect they have. Okay. So which clinical manifestation is associated with this disorder? What do you guys think? You guys are killing me. I'm so happy I did this Kahoot. Only 5 of you chose the correct answer, which is watery vaginal discharge. Let me tell you guys something. And please write this down if you don't know what I'm about to say. Watery vaginal discharge, painless bleeding. Okay. These are classic signs and symptoms of endometrial cancer. Especially painless bleeding. Matter of fact, painless bleeding, that's a classic sign for cancer, period. Endometrial cancer, lung cancer, colon cancer, you name it, painless bleeding. But you need to know that, okay? Let's talk about the other options. How are you guys doing on the live? Okay, good. Frothy vaginal discharge. 32 of you guys went with that. What does frothy vaginal discharge go with? Does anybody know what that's a symptom of? Frothy vaginal discharge. Trick, trichomoniasis. Okay. Next, thick white vaginal discharge. That's what a yeast infection. You're thinking of Candida albicans. And last, purulent vaginal discharge, which 57 of you guys went with that. Purulent. Once you see something says purulent, you should be thinking of some type of infection. Something like what? Something like pelvic inflammatory disease. Okay? Make sure you know these clinical manifestations and what they match with. Cloud says, what does that word mean? Which word, Cloud? Oh, PID stands for, what is PID? Pelvic inflammatory disease or disorder, I should say. Okay. Next question. All right, your AIDS patient asks why she can't have water from the pitcher that's been sitting at her bedside. What would be your best response? Ice water's healthier for you. You need the calories from juice instead. It's easier to control INO, or water that's been sitting for a period of time isn't healthy. What's the correct answer? Very good. Almost everyone got this correct. Water that's been sitting for a period of time isn't healthy. And it's true. And it's not only water, any fluid, any bodily fluid that's not moving is bad. So, you know how if a patient just has surgery, we want to get them walking. We don't want them staying in bed. Why? Because they were lying down on that surgical table for hours, not moving. They're not moving. Blood starts to slow down. Blood starts to slow down. It starts to what? Pool. We're worried about them having a clot, right? Water, fluid, urine, blood, saliva, any fluid that's not moving, guess what? Bacteria starts to grow. So imagine this patient that has AIDS, they're already severely immunocompromised. Do you think it's a good idea to give them a fluid that has just been sitting there that's a perfect medium for pathogens and bacteria to grow? No, it's not a good idea. Your magic number, guys, is 15 minutes. Any patient that is severely immunocompromised, water, juice, fluid that's been sitting for 15 minutes or more, they cannot have. You have to go get something fresh for them, okay? You can't see all the answers? Hold on. Hold on. Oop. Guys, please, these people just gave me another restriction. If you guys don't want to listen to me, I'm going to stop doing these Kahoots. I promise you. Well, I can't promise, but I'm pretty sure I'm not going to sell out. Please, just wait until the Kahoot ends. Please. Okay. Anyway, was there anything else that I wanted to say to you guys about this question? Oh, something else I wanted to say about this question. If you get a question about a patient that's severely immunocompromised, just some things you have to remember. If they're severely immunocompromised, you don't want them to have too many guests. You don't want them to be around crowds. You, of course, don't want them to drink anything that's been sitting around for 15 minutes or longer. Um, no fresh flowers. Everything has to be cooked. Like the vegetables have to be cooked, nothing raw. Um, no pepper. because pepper is a medium for bacteria, no pepper. They can have salt. I mean, unless they have like a cardiac issue, but they can have salt, but no pepper. Okay. All right. Moving on. Okay. Your 25-year-old patient with cystic fibrosis asks if his future children will have the disorder as well. What would be your best reply? Here are your options. There's a 25% chance your children will have the disease. Chances of reproduction are low. There's a 50% chance your children will be carriers of the disease, or most males with cystic fibrosis have many children without the disorder. Okay, so I'm very happy most of you guys got it correct. There's 25% chance you're oh, I'm lying to you. Chances of reproduction low. This is cystic fibrosis. Let me explain to you why this is the correct answer. And I'm going to explain to you why the 25% is incorrect because I know what you were thinking because I was thinking that at first and I had to catch myself. So let's go to the right answer and I'm going to explain the wrong answer. The correct answer is chances of reproduction are low. Here's the thing. Cystic fibrosis, it's an autosomal recessive disorder. So any disorder that's autosomal recessive, cystic fibrosis, what else is autosomal recessive? Sickle cell, right? If both of the parent, and it has to be both, if both of the parents have the disease and they reproduce, their child will have a 1 in 20, if 1 in 25 chance, if both of them have the trait to have a child, it's 1 in 25%. I can't speak. Let me slow down. Hold on, guys. Oh, guys, I'm sorry. Are you back? I'm sorry. My mom keeps calling me. I'm sorry. Okay. If both parents have the trait, and they reproduce, there's a 25% chance, that's 1 in 4, that the child will have the disease, they'll have the disorder. But that's if both parents, that's number one, right? We don't know anything about the other parent. The second thing that would make red incorrect, we're talking about cystic fibrosis. And cystic fibrosis, you're producing this very, very thick, tenacious mucus everywhere in every organ of your body. I'm talking about your lungs. I'm talking about your bladder. I'm talking about your spleen. I'm talking about everywhere. So guess what? For the males, even in the vas deferens. So that thick, tenacious sputum, I keep saying sputum, mucus, that thick, tenacious mucus, it blocks the vas deferens. So most males that have cystic fibrosis, they're sterile. They can't have children. And even if they can have children, guess what? If they've got cystic fibrosis, they have to reproduce with someone else that has cystic fibrosis in order to have the 1 in 4 or 25% chance of having a child that has that disorder. So that's why that one with 25% chance is incorrect. What are the other options? There's a 50% chance, no, false. And most males with cystic fibrosis have many children. No, they don't. Most are sterile. Okay. That's why the correct answer is chances of reproduction are low. Now, again, it's because it's cystic fibrosis. If it was another disorder, such as sickle cell, which is autosomal recessive, then it could have possibly have been red, the answer with 25%, if the person they were reproducing with also had that trait. Okay? It didn't say male. Your 25-year-old patient with cystic fibrosis, ask it his. It says right there, ask if his, as in male, future children will have the disorder too. So, yeah, in the question, we know it's a male. What were you going to say about autosomal recessive disease? No, just what I said before, that if both parents having they reproduce, that the child has a 1 in 4 or 25% chance. That's it. But you also need to know that cystic fibrosis is autosomal recessive, and for guess what, NCLEX, you need to know that for sickle cell. That's one of the things they ask. When it comes to sickle cell, they want to see if you know that it's autosomal recessive. They want you to know that the person will be at risk for stroke. And so usually what NCLEX will do, the person with sickle cell will be a child, because when you think of stroke, you don't normally think of kids, you think of adults, right? So they try to do that to trick you. So they test you on that. What else do they ask about? Oh, they want you to know that the person with sickle cell should be drinking lots of fluid. And they want you to know if the patient is in sickle cell crisis occlusive, your first action before giving oxygen is to give them fluids. So that's that. Okay, your patient has a duodenal ulcer. Which would you report immediately to the healthcare provider? Is it a blood pressure of 81 over 61 with a pulse of 119? Is it a pulse of 65 with respirations of 22? Is it a blood pressure of 111 over 89 with a pulse of 56? Or is it a pulse of 84 and respirations of 16? Again, your patient has a duodenal ulcer. What are you going to report immediately? Good job, Kyler. Very good. The minute you saw the word ulcer, it didn't even matter where the ulcer was. You saw ulcer, patient had a duodenal ulcer, they had a gastric ulcer. Immediately, you're going to be concerned about hemorrhage, right? So, what are you looking for? What are going to be those signs and symptoms that you're going to be looking for if there's internal hemorrhage going on? You're looking for that blood pressure to go down. You're looking for that heart rate to go up. You're looking for the respirations to go up. You're looking for that patient to have a pale or cyanotic color. You're looking at those RBCs to go down. You're looking at that H&H to go down, right? Those signs and symptoms of hemorrhage. By the way, you better know those signs and symptoms of hemorrhage, because from what I heard, that's a select all that applies on a very famous test. Make sure you know them. H&H go down. That's your hemoglobin and hematocrit. That's your H&H. Okay, guys? All right. Who's at greatest risk for Lyme disease? Would it be a software engineer, a middle school teacher, a veterinarian, or a landscaper? Who would be at the greatest risk for contracting Lyme disease? Software engineer, middle school teacher, veterinarian, or landscaper? Very good. I'm so proud of you guys. I put veterinarian there on purpose because I was trying to trick you and you didn't fall for it. Very good. Landscaper. Why? Because a landscaper is out in wooden areas, and that's where you're gonna find those type of ticks. Ticks that come from the animals that live in wooden areas, like what? Like deer and mice, right? Not a, now, let's talk about the veterinarian for a second, because the veterinarian, that actually goes with another test question. I'll tell you what that is. That is for Rocky Mountain spotted fever. So a veterinarian can catch that from a tick, but that kind of tick would be a tick that comes from pets, like a dog, right? So if it's a veterinarian or a tick that comes from a dog, it's Rocky Mountain spotted fever. But if it's a tick from like a wooden area, it's Lyme disease. Remember Lyme disease, that bullseye rash that develops like 7 to 10 days after being bitten? That. Okay, so make sure you guys know the difference between the two because, again, I don't write your exam, so I don't know which one you're going to get. You might get both. Make sure you know both of them, okay? Okay, true or false? The estriol level obtained during an amniocentesis indicates the degree of fetal lung maturity. Is this true or is this false? Thank you, Yori. Thank you. The estriol level obtained during amniocentesis indicates degree of fetal lung maturity. Is this true or is this false? Very good. That's false. That's false. Um, so tell me, what does it measure, guys? The estriol level. You guys know on the live? The estriol level? No. You guys are killing me. Okay, fetal well-being. That's what it measures. Fetal well-being. Now, when it comes to the lung maturity, which this you need to know for ATI, from what I understand, ATI asked about that a lot on the exit. LS ratio. Write that down. Go look it up later. LS ratio. That's for fetal lung maturity. Okay. Estriol is for fetal well-being. Okay. Which food is appropriate for a toddler? Hot dog, carrot stick, piece of cereal, raisin. Which food is appropriate for a toddler? Hot dog, carrot stick, piece of cereal, or raisin? I'm not going to yell. I see your answers, but I'm not going to yell. I'm going to be very calm. Okay, very good. Piece of cereal. Piece of cereal, it's easy to chew. You can swallow. It's not known to obstruct the airway, right? But look at a hot dog. Think about a hot dog. You cut up a hot dog for a toddler. Unless you cut that hot dog in triangles, which I don't know anyone who does that. They just cut the hot dog like that. The hot dog is still a circular shape. So imagine that circular shape getting stuck in that child's throat. There's no way for air to escape. That child will not be able to breathe. Their airway will be completely occluded, right? Carrot stick, that's a raw vegetable, hard to chew, easy to occlude the airway. Raisin, same thing. Raisin, grapes, uh, um, popcorn, anything that's hard to chew or round will easily occlude the airway. You want to give the child something that melts easily in their mouth or can be swallowed easily, okay? You can't see the screen. Is this better? Thank you, Jennifer. Thank you, Jesus girl. Okay. How would you administer potassium chloride to a hypokalemic patient? Slow IV push, rapid IV push, controlled infusion via pump, controlled infusion flow by gravity. Shanique, what? I almost said it. Very good. Control infusion via pump. That's the only way you can do that. Okay. Controlled via infusion pump. It has to be given on a pump. Unless you are, I live in the state of Florida, so we have the death penalty. So someone is getting a lethal injection. What is the name of the person who actually gives that lethal injection? They're not called a coroner. They're called, what are they called? The person who delivers, like, they're not called Terminator. Thank you. You are not an executioner. The only time you should be pushing potassium into a line is if you're an executioner. But you're not taking a test to be an executioner. You're taking a test to be a nurse. You want a nursing license. So you're going to give potassium on a pump, a controlled device. Remember, potassium has a very narrow therapeutic range, guys, 3.5 to 5. That is it. Anything outside of that, patient's going to have cardiac dysrhythmias. Okay? Terminator. All right, which is an adverse effect of, I'm not even going to try to pronounce that drug, doxorubicin. You see that drug, okay? Which is an adverse effect of this drug? Ventricular arrhythmias, alopecia, leukopenia, or stomatitis? Oh, thank you. You're absolutely correct. So Connor Peck said just make sure heart monitors are on when. No, he's not correct. I didn't read the whole sentence. When that patient is getting potassium on a pump, yes, they have to have a monitor. He said make sure you have the heart monitor when you're pushing the drug. No, you're not never going to push the drug. But when that patient is getting potassium, they need to be on the monitor. Okay, which adverse effect of this drug? Correct answer, ventricular arrhythmias. You guys need to know this. So, guys, this is a very common chemotherapeutic agent. Only RNs will give this drug. LPNs, LVNs are not going to give this drug. It has very toxic effects, cardiac arrhythmias. It can cause VFib, heart failure. Only an RN and an experienced RN will give this drug. What's alopecia? That's hair loss. Speaking of hair loss, um if you get a cancer, if you get a question about, a patient who's just been diagnosed with cancer, when are you going to help them, look for a wig, or they ask you a question about the hair. There's a couple questions like that. So I'm going to tell you what the possible answers are depending on the kind of question you get. Here's what you need to know. Number one, you need to know that when the patient starts chemotherapy, their hair may fall out or it may become very, very thin. When they stop, their hair will grow back. Now, it may not grow back to be as thick as it was before, but it'll, grow back, or should. That's number one. Number two is if they're interested, you should help them find a wig before they start chemo. So while the hair still has that shine, while it's still thick, they have whatever the style is, you're going to help them find a wig that matches the color, the style, and the consistency. Oh, what happened to my nail? And the consistency of their current hair right now. You're not going to wait until their hair starts to fall out. Why? Because if you wait, then they're going to be depressed. They may not even want to wig anymore. So you're going to be proactive and help them get it before. So that'll be a smooth transition once they need to start wearing the wig. Okay? We learned that in nursing school. I'm telling you, and you may see it on your exit exam. Don't say I didn't warn you. Oh, so I told you what alopecia was. Oh, leukopenia, that's decreased WBCs. You need to know your WBCs. They need to be between 5 to 10,000. And last, stomatitis, that's inflammation of like the oral mucosa. So famous question, you need to know about that. Any patient that has stomatitis, maybe from radiation, or it could be from something else. If the patient's got stomatitis, you're going to teach them about using a soft bristle toothbrush. You're going to teach them not to ingest anything that's harsh, like that has alcohol in it or lemon, because it's harsh. It's going to be painful to their mouth. Okay. Oh, that was our last question. 10 out of 10. Oh, this is our last one. All right, guys, let's see how you did. Okay, Shanique Danielle said the exit definitely ask. Listen, guys, I've been doing this for a very long time. If I tell you the chances are high that you're going to see something, the chances are high that you're going to see something. With that being said, if you have not gotten your copy of, I got the green screen on, but you know, my book, if you have not gotten your copy and you have to go take your boards, you need to go take NCLEX, make sure you get a copy of my book first and make sure you know everything in this book, especially what I have highlighted. Make sure you know it like the back of your hand and thank me later. That's all I got to say about that. All right, guys, let's see how you did.